everyone, I'm Dr. Ekta Bhushan, teaching sports nutrition at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. In this series, we will discuss different topics associated with the sports nutrition and weight management, but today in particular, we will discuss the topic obesity. So, overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. A body mass index, that is BMI, over 25 is considered overweight and over 30 is obese. The issue has grown to epidemic proportions with over 4 million people dying each year as a result of being overweight or obese in 2017. According to the global burden of disease, rates of overweight and obesity continue to grow in adults and children. From 1975 to 2016, the prevalence of overweight or obese children and adolescent aged between 5 to 19 years increased more than fourfold from 4% to 18% globally. Now, obesity is one side of the double burden of malnutrition. And today, more people are obese than underweight. In every region except sub-Saharan Africans or Asia, once considered a problem only in high-income countries. Overweight and obesity are now dramatically on the rise in low and middle-income countries, particularly in urban settings. The vast majority of overweight or obese children live in developing countries where the rate of increase has been more than 30% higher than that of developed countries. Now let's look into the definition of obesity. According to Webster's dictionary, define obesity as a condition characterized by the excessive accumulation and storage of fat in the body. And the Obesity Medicine Association defines obesity as a chronic relapsing malfactorial neurobehavioral disease wherein an increase in the body fat promotes adipose tissues dysfunction and abnormal fat mass physical forces resulting in adverse metabolic, biochemical and psychological health consequences. And to understand obesity, we have to understand BMI also. So BMI, that is body mass index, is a measure of weight adjusted for height calculated as weight in kilograms divided by the square of height in meters. Although BMI is often considered an indicator of body fatness, it is a surrogate measure of body fat because it measures excess weight rather than excess fat. So why use BMI? BMI is a simple, inexpensive and non-invasive surrogate measure of body fat. In contrast to other methods, BMI relies solely on height and weight, and with excess of the proper equipment, individuals can have their BMI routinely measured and calculated with reasonable accuracy. And BMI ranges for most adults, an ideal BMI is in the range of 18.5 to 24.9, and for children, young people aged 2 to 18, the BMI calculation takes into account age and gender as well as height and weight. If your BMI is below 18.5, you are in the underweight range. Between 18.5 to 24.9, you are in the healthy range. And between 25 to 29.9, you are in the range of overweight. And above 30, you are in the obese range. So let's look into the formula of BMI also. that is matrix BMI formula. BMI is equal to weight in kg oblique height in meter square. Multiply your height in meters by itself and divide your weight in kilograms by your step 1's result. Now let's see the accuracy of BMI, because BMI is always in the controversy whether we should do it or not. So BMI takes into account natural variation in body shape, giving a healthy weight range for a particular height. As well as measuring your BMI, healthcare professionals may take other factors into account when assessing if you are a healthy weight. So muscle is much denser than fat. So very muscular people such as heavyweight boxers, weight trainers and athletes may have a healthy weight even though their BMI is classed as obese. And your ethnic group can also affect your risk of some health conditions. For example, adult of South Asian origin may have a higher risk of some health problems such as diabetes with a BMI of 23, which is usually considered healthy. You should not use BMI as a measure if you are pregnant. Get advice from your midwife or GP you are concerned your weight about. Now there are three types of obesity also: class 1, class 2 and class 3. In class 1, obesity 30 to 35, in class 2 35 to 40 and class 3 above 40. And there is a word called morbid often comes. So let's see what it is. Morbid obesity is an outdated term for class 3 obesity. In medical language, morbidity means associated health risks. Doctor referred to class 3 obesity as morbid because it was not likely to come with related health problems. However, they retired the term because of its negative connotation. Now we will discuss causes and contributing factors to obesity. Although there are genetics, behavioral, metabolic and hormonal influences on body weight, obesity occurs when you take in more calories than you burn through normal daily activity and exercise. Your body stores these excess calories as fat. In the United States, most people diet are too high in calories, often from fast food and high caloric beverages. People with obesity might eat more calories before feeling full, feel hungry sooner, or eat more due to stress or anxiety. Many people who live in Western countries now have jobs that are much less physically demanding, so they don't tend to burn as many calories at work. Even daily activities use fewer calories, courtesy of conveniences such as remote controls, accelerators, online shoppings and drive-through bags. So first point is family inheritance and influences. So the genes you inherit from your parents may affect the amount of body fat you store and where that fat is distributed. Genetics may also play a role in how efficiently your body converts food into energy, how your body regulates your appetite, and how your body burns calories during exercise. Obesity tends to run in families. That's not just because of the genes they share. Family members also tend to share similar eating and activity habits. The second point is lifestyle choices. So the first one is unhealthy diet. A diet that's high in calories, lacking in fruits, vegetables, full of fast food and laden with high calorie beverages and oversized portions contribution to weight gain. And the liquid calories. People can drink many calories without feeling full, especially calories from alcohol. Other high calories beverages such as sugared soft drinks can contribute to significant weight gain. Then the third one is inactivity. If you have a sedentary lifestyle, you can easily take in more calories every day than you burn through exercise and routine daily activities. Looking at computer, tablet and phone screens is a sedentary activity. The number of hours spent in front of a screen is highly associated with your weight gain. The third point is if you have certain diseases and taking medications. In some people, obesity can be traced to a medical cause such as Prader-Willi syndrome or Cushing syndrome and other conditions. Medical problems such as arthritis also can lead to decreased activity, which may result in weight gain. Some medications can lead to weight gain if you don't compensate through diet or activities. These medications include some antidepressants, anti-seizures medications, diabetes medications, antipsychotic medications, steroids and beta blockers. The third one is social and economic issues. So, social and economic factors are linked to obesity. Avoiding obesity is difficult if you don't have a safe area to walk or exercise. Similarly, you may not have been taught healthy ways of cooking, or you may not have access to healthier foods. In addition, the people you spend time with may influence your weight. You are more likely to develop obesity if you have friends or relatives with obesity. Then the next factor is your age. So, obesity can occur at any age, even in young children. But as you age, hormonal changes and a less active lifestyle increase your risk of obesity. In addition, the amount of muscle in your body tends to decrease the age. Generally, lower muscle mass lead to a decrease in metabolism. These changes also reduce calories needs and can make it harder to keep off excess weight. If you don't consciously control what you eat and become more physically active as you age, you're likely to gain weight. The next one is some other factors other than that also are there, and they are: first one is pregnancy. Weight gain is common during pregnancy. Some women find this weight difficult to lose after the baby is born. This weight gain may contribute to the development of obesity in women. The next one is if you are quitting smoking. Quitting smoking is often associated with weight gain, and for some it can lead to enough weight gain to quality as obesity. Often this happens as people use food to cope with smoking withdrawals. In the long run, however, quitting smoking is still a greater benefit to your health than continuing to smoke. Your doctor can help you prevent weight gain after quitting smoking. Then, if you have a lack of sleep, not getting enough sleep or getting too much sleep can cause changes in hormones that increase appetite. You may also crave food high in calories and carbohydrates, which can contribute to weight gain. Then, if you are in stress, many external factors that affect mood and well-being may contribute to obesity. People often seek more high calories food when experiencing stressful situations. Then, microbiome. Your gut bacteria are affected by what you eat and may contribute to weight gain or difficult losing weight. Now let's see some hazards of obesity. So first hazard is you can get type 2 diabetes, and type 2 diabetes occurs when your blood sugar is higher than normal. Over time, this can lead to other health issues like heart disease, nerve damage, stroke, kidney disease, and vision problem. The next one is heart disease. Heart disease is more prevalent in people with obesity. Over time, fatty deposits may accumulate in the arteries that supply the heart with blood. People with obesity have higher than normal blood pressure, low density lipoprotein, cholesterol, triglycerides, and blood sugar, all of which contributes to heart diseases. The next one is a stroke. Stroke and heart diseases share many of the same risk factors. Strokes occur when the blood supply to the brain is cut off. The stroke can cause damage to brain tissue and results in a range of disabilities, including speech and language impairment, weakened muscles, and changes to thinking and reasoning skills. The next one is sleep apnea. Sleep apnea is a disorder in which someone may momentarily stop breathing during sleep. People who are overweight and living with obesity are at a high risk of having sleep apnea. This is because they tend to have more fat stored around the neck, making the airway shrink. A smaller airway can cause snoring and a difficulty breathing at night. The next one is high blood pressure. Extra fat tissues in the blood requires more oxygen and nutrients. Your blood vessels will need to circulate more blood to the extra fat tissues. This means your heart must work even harder to pump blood around the body. Then the liver diseases. People with obesity can develop a liver disease known as fatty liver disease or non-alcoholic steatohepatitis. This happens when excess fat builds up in the liver. The excess fat can damage the liver or cause scar tissue to grow, known as cirrhosis. Then gallbladder disease. The gallbladder is responsible for storing a substance known as bile and passing it to the small intestine during digestion. Bile helps you digest fat. Obesity increases your risk of developing gallstones. Gallstones occur when bile builds up and hardens in the gallbladder. People with obesity may have higher level of cholesterol in their bile or have large gallbladder that don't work well, which can lead to gallstone. Gallstone can be painful and require surgery. Then certain type of cancers. So because cancer isn't a single disease, the association between obesity and cancer isn't as clear as other diseases like heart diseases and stroke. Still, obesity can increase your risk of certain cancers including breast, colon, gallbladder, pancreatic, kidney and prostate cancers, as well as cancer of the uterus, cervix, endometrium and ovaries. Then pregnancy complications. Pregnant women who are overweight or have obesity are more likely to develop insulin resistance, high blood sugar and high blood pressure. This can increase the risk of complications during pregnancy and delivery, including gestational diabetes and preeclampsia. Then needing a cesarean delivery, blood clots, heavier bleeding than normal after delivery, premature birth, miscarriage, a stillbirth, defect of the brain and spinal cord. Then the next point is depression. Many people affected by obesity experience depression. Some studies have found a strong correlation between obesity and major depressive disorders. People affected by obesity may often experience discrimination based on their body size. Over time, this can lead to feelings of sadness and lack of self-worth. Now we have come to conclusion. So obesity can impact your physical health and your mental health. You may be unsure of where to begin, but taking steps now to manage your health and can prevent you from complications like type 2 diabetes and high blood pressure. Talk to your doctor about excessive exercising more and eating a healthy diet, seeing a therapist and other treatment methods. I hope you understood the concept of obesity, its importance and hazards of being obese. That's all for today. See you next time with some other interesting topics. Thank you.